Are doctors worthless? That's an important question. Let's look into that and think about it. Hello, I've got a question for you today. Are doctors worthless? The reason I ask that question is we see a lot of testimonies of different doctors on YouTube who, emphasize the fact that there's very little training in nutrition in medical school, and they will all admit that most of what they know about nutrition today is stuff that they've learned recently, and quite often because they themselves started having physical problems that their training couldn't address as far as any kind of natural uh, pathway to healing. And I'm a doctor of optometry, and I'll admit that we may have had a little bit of training in nutrition in optometry school, but it certainly wasn't emphasized. So are doctors worthless? Whether it's Dr. Jason Fung or Dr. Annette Bosworth, Dr. Ken Berry, uh, who I've really recommended on my channel so far. They're all MDs, all medical doctors. Dr. Fung, a nephrologist, Dr. Bosworth, an internal medicine doc, and Dr. Ken Berry, a very good family practice, board certified family practitioner. Uh, these are all very smart doctors, but they all admit that they have very little training when it comes to nutrition. It just wasn't really emphasized or a part of their training in medical school. So are they worthless? I promise I'll answer that question before we're finished, and you may already be kind of guessing what the answer is. Let's talk about sick doctors who themselves start to struggle with health problems. Doctors can get cancer, doctors can become diabetics. Um, you name it, any disease that afflicts humans can afflict doctors, and I believe this affects doctors in a profound way. Many of them, for the first time, begin to consider other alternatives when it comes to treatment. My own story, in fact, is one where once I was diagnosed with diabetes, I started searching feverishly, at a fever pace to find a way to treat it in a more natural way. I was 62 years old when I was diagnosed with diabetes with an A1C of 9.9, and I would have gone on medication if that was my only option, but I was already aware at that time just from things I had been learning actually from two different YouTube videos. I'd heard Dr. Sarah Hallberg and Dr. Jason Fung speak, and I was aware that there might be a way to get things back in line, get blood sugar back in line and everything without jumping straight to medication. And so I wanted to try that first, give it a 3-month trial, and it worked great for me. I got that A1C down from a 9.9 down to a 4.9 without any medication for diabetes. It was also able to come off of all the other medications I was on. So, and Dr. Bosworth and Dr. Ken Berry, both very smart, very gifted doctors, say that they were becoming insulin resistant themselves. And I don't know what their numbers were. Probably, I doubt if they were as out of control as I was. But the point is, something seems to change when a doctor gets sick. I heard a female doctor, I forget what her specialty was, but she was saying how she got cancer like in her 40s, and all of a sudden she became passionate about looking for the very best options to take care of her own health and all. And and she made the statement that has really struck home with me, that she thinks it's not possible to do this. This would only be in an ideal world, but she said, she thinks all doctors would be better doctors if they had had a life-threatening illness of their own. And because she said, she felt like she was a very good doctor up until she got cancer, but she feels like she's even better now. She's much more compassionate and much more, just driven to research the best cures, in her case for cancer, in my case for diabetes. And you can see that renewed passion. And Dr. Annette Bosworth, in first dealing with her mother's cancer, and then her own tendency towards insulin resistant, and Dr. Ken Berry, same thing. They're passionate now about the things that they do in the field of nutrition and that sort of thing. And what about young doctors versus old doctors? The young doctors, for the most part, are all healthy and haven't had any kind of struggles with health themselves. Are they worthless? Or is it only older doctors who've struggled that, with their own health issues? Are they the only ones that are worth seeing? And I guess I can't hold off any longer. I'm going to say the answer to that is no. Young doctors are very, very good. And doctors who haven't suffered from health problems of their own are very, very good, very helpful to their patients. I feel like up until age 62, I did a lot of good things. And I know that Dr. Berry and Dr. Bosworth and Dr. Fung all did great things for their patients. But you never stop learning. And so what are doctors good for? Well, certainly the training of doctors, while it may be deficient in nutrition, it's excellent in terms of being familiar with anatomy and physiology and biochemistry, and those are very, very useful tools, especially when it comes to diagnosing problems. So the diagnostic skills of all doctors are extremely, extremely useful, in their knowledge of medications and possible side effects and all those problems. And I haven't even touched on surgery yet. I mean, if you break your leg, you want to see an orthopedic surgeon. Surgery can be a life-saving thing. And if you need heart surgery, you want somebody that really knows it. So yes, of course, doctors are very, very useful. And I would say the only area that they're really weak on is on non-medical, non-surgical treatments for things. But, we can't ignore all the things that they are useful for. And as far as young versus older doctors, there's a lot that comes with years and years of practice in terms of bedside manner and patient interactions. But a lot of these young docs are super, super smart when it comes to diagnosing problems. I think in an ideal world, you have a young doctor and an old doctor working together, and this young doctor with his latest, greatest training and experience with all the latest diagnostic tools can be a real powerhouse when it comes to diagnosing medical problems. But that older doctor has something to offer that the younger doctor might not as well, in terms of people skills and if they struggle with health issues themselves and have become passionate about nutrition and more natural ways of doing things. That's extremely powerful. And so I would have to say, yes, doctors are extremely important. The diagnostic skills, all that basic science knowledge is just invaluable. It's extremely important. And so if you add to that extremely strong foundation that doctors have, if you add additional learning to that in the fields of nutrition and more natural type healing, that's a powerful combination. So what I'd like for you to do is think of all the training and all the science knowledge and all the experience that doctors have, like a big toolbox that's full of really, really valuable tools that they can help you with. And there may be one tool out of that toolbox that's missing, and that might be in the area of nutrition and other more natural ways of healing. But that doesn't negate the importance of all the other tools in the toolbox. Again, in my own story, I worked very closely with my primary care physician, and I would recommend that everyone work closely with their primary care physician. It was my PCP that let me know I was diabetic in the first place. He ordered all the blood tests and did the physical exam and everything that diagnosed me with being diabetic in the first place. And he's the one that I worked with in coming off of all the medications I was taking, the 2 blood pressure medicines, the cholesterol medicine. It was in consultation with him that I gave up my CPAP. I now take no medications at all. So do I not need a doctor anymore? I do, and I will continue to see my primary care physician, and you should too, because the diagnostic knowledge and the experience that doctors have is worth a lot. And if they just add that one extra tool to the toolbox, they've got an amazing thing they can offer you. But even without that nutritional tool, they still have a lot to offer. Now, in my own story, I had researched a lot of these nutritional areas out myself, and my doctor was open to the concept. Yours may not be, but my point there is that your healthcare should be a partnership between you and your doctor. You can still research things out for yourself and have, maybe write down questions that you can ask and just politely ask, well, before I start on that metformin for my blood sugar, can I have about 3 months to see what I can do? That's what I asked my doctor. I said, I understand you want to start me on metformin, but can I have 3 months to see if there's anything I can do to lower it? And he welcomed that concept. He's open-minded that way, and not all doctors are. But at any rate, the best relationship with a doctor is where it's a partnership and you work together. And so yes, the answer is yes, doctors are very, very useful. And just because one little tool or one important tool may be missing out of the toolbox doesn't mean that they're not useful. After all, you can bring that tool with you when you go to your doctor. You can bring questions and knowledge about nutrition with you when you come to see your doctor. So I'll end by saying, live healthy, finish strong, and see your doctor. Thank you.